So welcome to 5.2. Here we're going to talk a little bit about non-hormonal treatment options for menopause care. So there are FDA-approved non-hormonal treatment options that exist for patients, and what they do is they blunt the hot flashes and they may help with some sleep. As of 2025, there are about 5 to 10 medications that are in research and in development for FDA-approved treatments for vasomotor symptoms. So one of the first ones I want to talk about is paroxetine, or it's also called Brisdel, which is the trade name for it, but it is an SSRI, a selective serotonin reuptake inhibitor, or an antidepressant, if you will, and it's an ultra low dose antidepressant. And the way it works is that it's about 7.5 milligrams per capsule, and the patient can take it, and it does make quite a difference with helping with those hot flashes and night sweats. It's not going to be a gold standard option as first line if a patient can do hormone therapy, but of course we have patients that may not be able to take hormone therapy, so it's also important to think about that as well too. We have a newer product out. It's been out for a couple of years now. It's called fezolinetant, or the brand name is called Veoza, and it's actually a candy peptide, and the candy stands for kisspeptin, neurokinin, and beta-dynorphin, and neuroendocrine 3 receptor. It's a newer one. It's first in class, and it is a selective neurokinin 3 receptor antagonist, and it works to directly block that neurokinin B, which is known to trigger those vasomotor symptoms of the hot flashes and the night sweats. So a lot more data is needed on it, but that definitely is an option. And the patients that come to you that are afraid of hormone therapy, this could be a really good option for them. In terms of other non-hormone therapy, I'm going to make sure that you have in this course the position statements from the North American Menopause Society. They have a position statement from 2023 on non-hormonal options. And so some of the things that they are going to recommend are mind and body techniques, clinical hypnosis, cognitive behavioral therapy, and then some different types of prescription medications, the SSRIs, as well as the selective norepinephrine reuptake inhibitors, the SNRIs, which is going to be things like your bupropion and things of that nature. Gabapentin, a medication that we often use for pain, is also great for helping with sleep. It can be used as off-label. A lot of these are off-labels. The SSRIs and the SNRIs are going to be an off-label use. You heard me talk about fezolinetant in that first slide, and then we have oxybutane. Some of these will help with different types of vasomotor symptoms that are there. Some weight loss helps. And then I also just want to make a note about the stellate ganglion block. A lot of people don't know about that, but it is a needle that's actually put into the neck space with someone, and it usually can help moderate hot flashes and night sweats. It's actually used as a trauma prevention approach for PTSD, but it does have some benefit with moderating vasomotor symptoms. Also, in terms of continuing on with the menopause position statement, there are some other options that are there. It's not recommended, like the yoga and the dietary supplements or acupuncture, but for a lot of patients, there is some anecdotal evidence. Unfortunately, we need more evidence-based and more research on it. But for some, those things do kind of help. But again, I'm pointing you out to the menopause position statement, but there are some medical therapies that can sometimes work for patients. Some patients do well with acupuncture and things like that. So I just want to make sure that those are there for you to understand. In terms of the approved non-estrogen therapies, you can see them all listed here. I wanted to put them in table form for you so that if you do need to bring them to your healthcare provider, it tells you the med, the route, the brands, the dose, and just some things to consider when you talk to your healthcare provider. In terms of supplements, there's different types of phytoestrogens that are out there. The evidence behind them is that it's really weak. There's not a lot of great information, but sometimes they work for some. There's some black cohosh studies have found that even though it may effectively alleviate hot flashes, the evidence is still really mixed. We need a lot more long-term data on supplements. Red clover, a few studies have found that those isoflavonoids may help actually reduce daily frequency of hot flashes, so just something to consider from baseline. But I just kind of wanted to put those out there for you as you go and you navigate, maybe go into the supplement or the health food store and talking to your healthcare provider, because you have to do what you are comfortable at the end, but I want to arm you with all the evidence-based information. All right, so we're going to go into part 6, probably one of my most favorite things to talk about with my patients because it's so taboo and I want to make sure you have really good information. So the next up is going to be sexual health and menopause.